When blood test results come back abnormal, it can be confusing and concerning, and you ask yourself, what do those test results really mean? Today, we're joined by Dr. Leidy Isenalumhe from Moffitt Cancer Center, and we're going to find out more about how to deal with those results and a new specialized service designed to give patients clear answers, early evaluation, and most importantly, peace of mind. Doctor, so great to have you. How are you today?
Thank you. I'm very happy to be here. Thank you so much.
I'm so happy to get the word out about this new service. Before we get into it, let's talk about what happens when a patient gets lab results back and they're abnormal blood work, I should say. We're talking about blood work. And you see something with your white blood cells or your platelets or your hemoglobin is off. It can cause panic. You wonder what to do.
That's a great question. One of the things that we tell patients, whenever there's abnormal blood work, and it can be obviously scary and very daunting, but it's always better to have that evaluated. Don't think of the worst. But what this new service is going to offer is evaluating those abnormal results. It can be an elevated white count, it can be anemia, it can be your platelets being elevated or low. And the goal is to have that evaluated to ensure that it's nothing that could just be benign or something that needs further workup or treatment.
And let's look at this new blood service. This is revolutionary, really exciting to have it right here at Moffitt Cancer Center. How does it work?
So it's a great service that we're offering for patients that have abnormal blood work or abnormal symptoms, but they don't have a diagnosis yet. For example, if your blood work shows an elevated white count, or that there's an abnormal protein in your blood concerning for what we call MGUS, or monoclonal gammopathy of undetermined significance, or you think you have an enlarged lymph node or a mass in your lymph nodes, and that's something that we come in and we evaluate those results and we do the workup in one setting and perform tests to determine if it's something benign or do you need further workup or if you need some sort of treatment in the future or just close monitoring. But it will give a peace of mind to have that workup determined.
And that peace of mind is so important, especially when you're hearing terms. Maybe you've been diagnosed with MGUS, which I don't know what that is, myeloma, some of those conditions.
Yeah, so MGUS stands for monoclonal gammopathies of undetermined significance. It is a benign condition, but it does need to be monitored closely. There's a percentage of patients where it can progress to myeloma when you will require treatment. So that's something that we don't want to ignore abnormal blood works, but I also don't want to bring panic to anyone. And that's why having the peace of mind of having that evaluation and being told if it's benign or you just need monitoring or further workup. And we'll be able to process all that at Moffitt.
So what should that person do who maybe, what symptoms should they be looking for, or, maybe particular blood work where they're saying, hey, I think this might be the service for me? Who is that for?
That's a great question. And now the symptoms that are traditionally associated with blood issues tend to be if your blood count for your red cells are low, you tend to have anemia, you can be very tired and fatigued. Or if you start having elevated white count, or if your counts are very low or abnormal at a range, that's something to look into. But you can determine having recurrent infections, or you can have fatigue, unexplained weight loss, or masses. Things are things that we have to look for. But also, not everyone presents with symptoms, and that's why blood work, if they're abnormal, you don't want to ignore them. I don't want you to panic, but you want to ignore them. You just want that to be evaluated to determine if that's something that's serious or something that just needs to be monitored.
Right, great information. Our blood definitely tells a story about us, right? It's fascinating. I love these technological advancements that you have them here at Moffitt, and we want to share that information with our viewers right now so they can take a look on the screen as to where they can find out more. Of course, you can always call and you can visit online, moffitt.org. Doctor, I learned so much today. Thank you.
Thank you so much for having me. Thank you so much.